Can you take Mounjaro if you also have psoriatic arthritis? It's a question we're hearing more and more as Mounjaro becomes increasingly common in the UK, and it's a really important one to answer properly. These are two very different conditions that need very different treatments, so managing both at the same time takes some careful thought. Let's break it down. Mounjaro, or tirzepatide, is a once-weekly injection licensed in the UK for type 2 diabetes and weight management. It works by mimicking two hormones, GIP and GLP-1, that your body naturally produces to regulate blood sugar and appetite. It's available through the NHS for eligible patients who meet the criteria set out by NICE, which typically includes a BMI threshold and treatment within a specialist weight management service. Psoriatic arthritis is a completely separate condition. It's a chronic inflammatory disease that affects the joints, tendons, and sometimes the spine in people who have psoriasis. Without the right treatment, it can cause irreversible joint damage over time. That's why it's managed with specific disease-modifying drugs or biologics that target the underlying inflammation, things that work on pathways like TNF-alpha, IL-17, or IL-23. Here's the key point. Mounjaro is not licensed to treat psoriatic arthritis. It has no role in managing inflammation or joint disease, so your specialist treatments for that condition remain absolutely essential. Mounjaro does not replace them in any way. The reassuring news is that there are no known direct pharmacokinetic interactions between tirzepatide and the DMARDs, biologics, or JAK inhibitors, typically used for psoriatic arthritis. In other words, these medicines don't appear to interfere with each other at a chemical level. However, there is one important consideration. Mounjaro slows gastric emptying, meaning it slows how quickly food and medicines move through your stomach. This can potentially affect how well certain oral medications are absorbed, particularly oral contraceptives and any medicines with a narrow therapeutic index, where the difference between an effective dose and a harmful dose is quite small. If you're taking anything in that category, make sure your doctor knows. There are also a couple of broader safety points worth mentioning. If you use insulin or a sulfonylurea alongside Mounjaro, there's an increased risk of low blood sugar, so discuss that specifically with your clinician. And tirzepatide is not recommended during pregnancy or breastfeeding, so if that may apply to you, please seek personalized advice from your doctor. So what should you actually do with all of this? If you're living with psoriatic arthritis and you're being considered for Mounjaro, or you're already taking it, the most important step is making sure all of your specialists have the full picture. Your rheumatologist and your prescribing doctor both need to know everything you're taking. Never stop or adjust your psoriatic arthritis treatment without speaking to your rheumatologist first. On the safety side, a few symptoms should prompt you to contact a healthcare professional promptly. Severe abdominal pain needs urgent attention. It can be a sign of pancreatitis, which is a known risk with Mounjaro. Hot, swollen joints that feel different from your usual psoriatic arthritis symptoms should also be assessed. And persistent vomiting that's stopping you from keeping food or medication down. Don't wait. Get in touch with your healthcare team. So to bring it all together, 3 things to take away. First, Mounjaro is not a treatment for psoriatic arthritis, and your existing PSA medications must be continued as prescribed. Second, there are no known direct interactions between Mounjaro and PSA drugs, but Mounjaro's effect on gastric emptying means some oral medications may be absorbed differently, so always tell your full prescribing team what you're taking. And third, managing both conditions at the same time is absolutely possible, but it requires proper coordination between your specialists. Nothing in this video is a substitute for personal medical advice. Please speak to your GP, rheumatologist, or pharmacist about your own situation. If you found this helpful, leave us a comment below. We'd love to know what topics you'd like us to cover next. And if you haven't already, please give this video a like and subscribe to the Bolt Pharmacy channel for more straightforward health information.